Hello everyone. This presentation is on Tang, also called for gentleman decoction. It is on the California Acupuncture Board herbal formula list. I will briefly review the traditional pattern, a hypothetical patient, 3 possible drug-herb interactions, and a practical management plan. The goal is to connect traditional Chinese herbology with modern medication safety in clear student language. Traditionally, Tang belongs to the category tonify Kai. A representative pattern is clean Kai deficiency with fatigue, weak appetite, and loose stools. Important ingredients include Ren Shen, Baizhu, Fu Ling, Gan Kao. In practice, the formula should be chosen by matching the full pattern, not simply by matching a biomedical diagnosis. I would also screen for red flags, confirm that urgent medical care is not being delayed, and review all medications, supplements, and over-the-counter products before recommending treatment. My hypothetical patient is 55-year-old man with chronic fatigue and poor appetite. The current medicines are warfarin, metformin, hydrochlorothiazide. This case gives a possible reason to consider Tang, but it also creates interaction questions. I would document tongue and pulse findings that support the pattern, confirm the diagnosis, and ask about kidney or liver disease, bleeding history, pregnancy status when relevant, and prior reactions to herbs or supplements. Medication reconciliation is essential because many clinically important interactions come from the combined physiologic effect of herbs and pharmaceuticals. Interaction 1 is Ren Shen plus warfarin. The mechanism is that ginseng may alter warfarin response. The clinical significance is potentially moderate. My management plan is monitor INR more closely during use. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. Interaction 2 is Ren Shen plus metformin. The mechanism is that ginseng may lower blood glucose. The clinical significance is moderate in sensitive patients or with reduced intake. My management plan is check glucose and review hypoglycemia symptoms. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. Interaction 3 is Gan Kao plus hydrochlorothiazide. The mechanism is that licorice may worsen hypokalemia and hypertension. The clinical significance is moderate. My management plan is monitor potassium and blood pressure and avoid extra licorice. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. In conclusion, Tang may be reasonable when the patient truly matches the pattern's clean Kai deficiency with fatigue, weak appetite, and loose stools. The safety question is not whether herbs are simply safe or unsafe. Risk depends on the specific ingredients, the product quality, the dose, the treatment duration, the patient's organ function, and the medicines being taken. I would start conservatively, monitor the most relevant objective values, and communicate with the patient's physician and pharmacist. This presentation is educational and does not replace individualized medical care. Thank you.